A bite of something firm sends two signals at once. A pulse of force travels down into the jaw, and a wave of blood moves up into the brain. A soft diet quietly removes both, and almost no one notices the removal because nothing hurts. Consider the moment of biting into a raw apple or a crust of dense bread. The teeth meet resistance, and that resistance has a number. On the back molars, the force a healthy adult can generate runs into the hundreds of newtons, several times the weight of the head it sits beneath. That force does not stop at the enamel. It passes through the root, into a thin layer of fibers, and into the bone that holds the tooth in place. At the same time, the rhythmic work of chewing raises the flow of blood toward the brain, an effect that has been measured directly, even if the exact plumbing behind it is still debated. So a single bite is two events. It is a load delivered to bone, and it is a pump working near the brain. Replace that bite with something already soft, something blended or stewed into surrender, and the load is gone and the pump barely turns. The tooth still chews in a sense, the mouth still moves, but the two signals that the act of eating was quietly delivering have been switched off. Nothing announces this. There is no pain, no warning, no symptom on the first day. There is only an absence, repeated 3 times a day, for years. The mechanism behind why that absence matters is worth drawing out carefully. Start with the bone that holds a tooth. It is easy to picture it as a fixed socket, a piece of hardware drilled into the jaw. It is not. The bone around each tooth, the alveolar bone, is living tissue, and it follows the same rule as the rest of the skeleton. That rule has a name, the mechanostat, and it works like a thermostat for bone. When a bone is loaded, it senses the strain and maintains or builds its density. When the load disappears, it reads that absence as a signal that the bone is no longer needed, and it begins to give the material back. The tooth is not bolted into the jaw. It hangs in the socket on a thin sheet of fibers, the pair EO-DON tool ligament, and every bite stretches and compresses those fibers. That stretch is the load the bone is waiting to feel. Now follow what happens when a tooth is lost, or when the diet stops asking the jaw to work. The fibers no longer pull. The bone no longer reads strain. And the mechanostat does what it always does in the absence of load. It resorbs. The ridge of bone that once held the tooth begins to thin and recede, often within months. Dentists see this plainly under a denture, where the bone beneath keeps shrinking year after year because the denture rests on the gum and never loads the bone the way a root once did. So the ridge does not simply wear out with age, it is released, not from damage, from the absence of the signal it was built to answer. Now hold the modern plate against the plate of almost every human who came before. For most of that history, a meal was work. Roots, tough meat, raw vegetables, coarse grain, fibrous fruit. The jaw closed against real resistance hundreds of times in a sitting, and each closure delivered its load and its pump. The food was not chosen to be hard, it simply was hard, and the body that evolved to eat it came to expect that work as a constant input. Compare that to a plate built for convenience, bread that dissolves before it is chewed, meat cooked until it falls apart, vegetables steamed soft, fruit pressed into juice, whole meals turned into a smoothie and swallowed in a minute. Each of these is easier, and ease is the entire point of them. But ease, measured in newtons, is the removal of load. The jaw that once worked through a meal now glides through it. The difference between the two plates is not a matter of taste, or of which is healthier in calories. It is a matter of physics. One plate sends the jaw a steady signal of strain and a steady pulse of circulation. The other sends almost nothing and asks the body to maintain a structure it can no longer feel being used. Soft food is not gentler, it is quieter. This is where age turns a slow drift into a spiral. After 50, several of these inputs tend to fail at once. Teeth are lost or ache, and a sore tooth is a powerful reason to choose the softer option. Chewing becomes tiring or uncomfortable, so meals shift toward what slides down easily. Each of these choices is reasonable on its own, and each one removes a little more load and a little more of the chewing pulse that helped move blood toward the brain. The bone reads the lighter load and gives back more ridge. The thinner ridge makes the remaining teeth less stable, which makes chewing harder still, which pushes the plate softer again. That is the shape of the spiral, each step making the next step more likely. There is a second thread worth naming carefully. In animals raised on powdered, no-chew food, learning and memory measurably suffer, and the hippocampus, the region tied to memory, shows the strain. In people, tooth loss and poor chewing tend to travel alongside cognitive decline. That link is an association, not a proven cause, and the confounders are real: general health, nutrition, inflammation. So the honest stakes are these: the jaw loses bone it could have kept, and the brain loses a pulse of circulation it was quietly receiving. What this points to is mild, and it is not a cure for anything. The intervention is to keep the work of eating in the diet, on purpose, rather than removing it by default. A meal does not need to be a feat of force. It needs to ask the jaw to close against something real. Leave some raw vegetables raw, carrot, celery, a firm apple eaten whole rather than juiced. Choose denser breads with a real crust over the kind that dissolves. Keep whole fruit instead of pureeing it into a smoothie out of habit. If the teeth allow, nuts and firm dried fruit return a great deal of load per bite. The principle is simple. Before blending or stewing a food into softness, ask whether the chewing was the point. Often it was. There is a hard boundary around this, and it matters more than the protocol itself. None of this means biting through pain. A cracked or aching tooth, a sore jaw joint, a history of fractures, these are signals to stop and to see a dentist, not to push harder. Teeth are not tools for breaking ice or shells, and a broken tooth removes far more load than a soft meal ever would. The work that matters is ordinary chewing on ordinary firm food, kept in the diet rather than engineered out of it. And where teeth are already gone, restoring the bite through dentures, and better still through implants that load the bone again, is part of the same logic. Step back and the shape of the thing is plain. The bone that holds a tooth and the circulation that feeds the brain are both kept by a signal that the act of eating used to deliver for free. Soften every meal, and that signal fades without a sound, mistaken later for the ordinary arithmetic of getting older. The jaw does not thin because the years passed over it. It thins because the load it was built to answer stopped arriving. The pump near the brain does not slow because the brain aged. It slows because the work that drove it was removed from the plate. This is why the framing of mere aging is so easy to accept and so often wrong. Aging is real, but a great deal of what gets filed under it is simply input that was withdrawn so gradually that the withdrawal never registered. The bone and the blood do not ask for much. They ask only that the ordinary act of eating still carry the work it always carried. None of this asks for force, or for grinding through discomfort, or for treating a meal as exercise. It asks only that the work of eating not be quietly deleted in the name of ease. The body does not maintain a structure it cannot feel being used. It maintains the parts it is still asked to work.